Walter and Donna, oh, what a pair. They laugh and talk and chat 'cause life ain't fair. So zoom on in and pull up a chair. From Zoom stalker to Zoom talker, he went from Zoom stalker to Zoom talker. Zoom talk, you gotta Zoom talk, you gotta Zoom talk. Come on and Zoom talk.
Today on Zoom Talk, we get to reconnect with a very special Zoom kid from season 2 of the original Zoom, Ann Messer. Ann grew up to become a doctor and turned Zoom's spirit of connection into something truly wonderful. Ann's now the founder of One Good Turn. It's a global health nonprofit that provides practical medical education and culturally sensitive medical care to underserved communities worldwide. From Zoomer to doctor to someone helping people show up for each other in real life. This is exactly the kind of full circle story we love around here. So welcome to Zoom Talk, and this is our interview with Ann Messer from season 2.
Come on and Zoom talk.
Biddy butter bot burns butter, blessed she burns butter's bitter. But it's blended in my batter and it's made my batter bitter. Now if I blend some better butter better than the bitter butter, it'll make my batter much better. Bitty butter blended better butter, better than the bitter butter. Beat it into the bitter batter. Now the bitter batter's much better.
But welcome, Ann. Thank you for being here.
Oh my
We
gosh.
love you.
So glad to be here. And I love you too. Absolutely. It's just amazing. And Walter, it's really nice to meet you finally.
Yeah, you too, man. God bless you. Donna, I'm not doing my thing. I'm just going to be calm.
Oh, Walter, just be fully self-expressed. You know, you're great. Just be you,
Well,
hon.
Absolutely.
Well,
Totally
thank
agree
you.
with that.
Zoom stalker to Zoom talker.
That's the whole Zoom spirit, is just
Yeah.
be
I know.
yourself, right?
Absolutely.
All right. Well, okay. Where are you talking from now? Austin?
Yes, I'm in
Where-
Austin, Texas. I'm sitting at my dining room table. I could unblur it, I guess, if I wanted to.
Tell us anything. We're here to talk about Zoom, but we're here to talk about after Zoom and even after Zoom and
After.
anything that your heart desires. And really do want to talk about One Good Turn, which I think is one of the most inspiring organizations going on right now. So really looking forward to doing a deep dive if you so choose.
Yeah, no, that sounds fantastic. Yeah, I guess all those things, right? I think it's fascinating to me that all the Zoomers were clumped together in this experience when we were all little, and then everybody really sort of spread out for a long time. And it's been fun as adults to sort of come back together. I think both physically, since we've all gotten a chance to see each other 2 or 3 times now, but also just sort of, being in regular touch. That's really cool to be able. And then I think we can all celebrate where everybody is at this point in the game too, which also is fascinating to me that we've all done such different things. I think that's really interesting too.
But let's talk about you. Tell us your life story.
Well, and Dr. Ant, before you start, please include how you got on. And it wasn't the normal channels. Can you tell us that story?
Normal channel. That's so funny. I literally, first time I thought about that was last night in a million years. My husband's like, you don't really ever talk about it. I'm like, I know, because it was like this singular thing. Like, it's hard. I don't know. It's hard to talk about it. Yes. Okay. So Walter, I loved Zoom when I was a little kid. Oh my gosh, watched every single show. And we were only allowed to watch a half an hour of television 3 times a week when I was a little girl. So we just had a black and white TV. We got a color TV once I was actually physically on the show. So my family didn't watch television. We weren't allowed to watch cartoons, all those things. But Zoom, we could watch. And I absolutely loved it. So Nancy came on and announced that there was going to be a new cast of Zoomers and you could write into box 350. So I was so excited, and I did, and they sent me a little application, which I filled out, and I anxiously waited, and I got a letter back in the mail saying, you actually aren't that good. Never mind, we don't want you. It wasn't quite that, but I'm sorry. It was like, we're so sorry, but you're, whatever reason, you don't qualify. So I was devastated. But my friend up the street got an audition. And she was really excited and nervous, and she wanted me to come with her. And I said, well, I can't go. I don't have an audition. And she said, well, we've got to get you an audition. And so I took her audition and a piece of tracing paper and I put it in a typewriter, the kind with the roller, and I typed out the application, her second application that I never got, onto a piece of tracing paper. So I literally copied it word for word. I would pay $1 million to have that right now, and pulled it out. And then I filled out the tracing paper application. And we went on a Saturday afternoon. Her mom drove us both, and we went to Zoom. And when you got there in the lobby of WGBH Boston, they had all these volunteers waiting in people's letters. So my friend's last name was different from mine, so I didn't see her again for the rest of the day. And we went up to the M, and I walked up to the lady with my little piece of tracing paper and said, I didn't actually get an audition, but I made a copy from my friends. And the lady looked at me and she just burst out laughing. And she goes, that's all right, honey. It'll fit right here.
Wow, I love that you were so honest. Like,
isn't it? Well, I was obvious. I mean, it was clearly not actually the application. And I think, I mean, I never saw that piece of paper again, but I'm sure it followed me because that was the only way they knew who we were. And I got a call back, and then I got another call back and another call back, and then it was time to be on the show.
How plucky. It's like one of those 30s musicals where the plucky star just triumphs.
you were so great on the
Oh.
show too. This was, I was just an audience member at the time, but I just loved you. You had such a beautiful presence, not only physically, but just so empathic and kind and intelligent and talented.
If you have a story or play you'd like to see on TV, write Zoom, Box 350, Boston, Mass. 02134. Zoom will resume after this little message. Habai gabais, gabas wabba dabas. Abit samam, abababi dabababi papa pupper, daba papa pupper, dabat scabba robin tubbied, nabat tabu mabak yabu snubbies, abe vabin, abif yabu snubbifippet. Ha, ha, ha. Abai fubble jabu daba tabam. Now, back to Zoom. Achoo!
Which I would say it has followed you for the rest of your life.
Oh, that's amazing. Well, thank you for saying that. You know, it's funny. I didn't really have a sense of like the cameras on me. Like, I don't know quite how to, I've thought about this somewhat because I do think I do a lot of public speaking now. I much more had a sense that there were a really lot of people out there. And I think that particularly happened because I'm sure you had this experience for a very long time. I couldn't go anywhere without being recognized. And also I moved right after we got done with Zoom, but the season that I was on stayed where I moved to for like 2 or 3 years. So I was on television every single day for a really long time. And I continued to kind of look like myself too, which was part of the problem.
And
But-
you still do.
Oh, you know what? I have my Zoom picture. It's over here. So that's like my only remnant of Zoom that I have left. So anyway, I don't know. That's interesting because I felt like I didn't really feel like I was being filmed at all. It more felt like we were just together having this cool experience because we were in this really cool building. And so I felt more like that. And then it was much later when I was still on the show all the time and being recognized constantly that my sort of concept of what had happened during that time
Right.
changed for me.
Did you become self-conscious after that?
You know, I think very early on, I realized that the physical appearance of me on a television was like a symbol, that it wasn't actually me. And so it wasn't that I was self-conscious, but I was just very aware that the people who were talking to me or, singing from the distance or whatever, they weren't actually talking to me. Like they were talking to their image of somebody on a television show with whom they've had some kind of emotional response.
Right.
But it wasn't actually me. And so then that allowed me to, I don't want to call it dissociate, but that's a little bit like what it is. Like to not really be self-conscious or be bothered because it wasn't actually about me. Would never, ever felt like Zoom was about me, ever, at all.
Okay. How old were you when you were on it?
11 and 12. Either that or 12
That's
or 13.
a very self-aware or mature way to think at that age. A very unnarcissistic way to be. And usually, though, children, it is always about them, or they can't see past themselves.
Yeah, I don't really know where that came from, but absolutely. The other thing is, I don't know if they did this with your cast, Donna, but they never missed a chance to tell us that we were chosen for the show because we were ordinary and that we were average and that we really shouldn't think of ourselves as being anything other than ordinary and average.
True.
And I thought to myself, can I swear on this show? That's
Yeah.
bullshit.
Yeah.
I mean, you don't pick people for a national television show because they're average. That's like, I didn't believe it. So then I was like, okay, we've got something. And I think that what we definitely all shared was charisma. I think every single person, and you have to have that to have any kind of a liveliness come through on the other side of a television camera. Because again, it's not me. It's an image of a person that goes through a television camera that then gets onto a screen and turns into electricity. And you have to have something akin to a charisma, if not just directly that, in order for your presence to even be felt. And I do know I have that because I know I have that. Like again, don't want that to be a braggy thing because I think it's just a statement. Like some people have it, some people don't. I don't even know if you can learn how to do it. I'm not sure. So it was just an interesting mix of being really aware. I think that's one of the reasons I wasn't afraid of the television camera. I don't know if you remember, but it had that huge black lens that looked like an eye. And I just somehow inherently knew it's like that. I'm like, I know I'm looking at you guys, so my eyes aren't directly meeting the screen, but I just knew that if I looked right into that hole and talked, it was going to get transmitted to other people. And so again, it still wasn't about me. It was about the recipients. And that I think has carried into my career now for sure.
I love that.
When we had Tommy on, he said that, I don't know if it's Mr. Sarson or somebody said the reason they went through everybody and said, this is why you were chosen. And I can't remember what Tommy's reason was. Do you remember anything like why you were chosen? I guess.
No, we got told that we were average.
No.
And I guessed maybe it was because Nina went off the show and she had long dark brown hair or blonde hair, and so did I. And I also know that they liked it that I could dance. So that was part, because I was trained classically in classical, but I trained at the Boston Ballet until we moved. So
Really?
like
what age did you start?
Oh, so young, 4 or 5, something like that.
Oh,
So
wow.
yeah, I did the Nutcracker every year. And like I spent my Wednesdays and my Saturdays before Zoom, I was at the Boston Ballet. So I don't know. I figured that was it. I don't know. Honestly, I still have no idea why they picked me. I think it's more the charisma thing.
Well, they wanted kids
personality,
who were comfortable and who also could easily connect with others. And, we became a family or a cohesive group with whomever we were with. So, and Maura's going to be coming on later. So you guys can go through memory lane and really talk. Totally. But do you have a special memory when you were on the show?
I don't know that I have a particular one, because since it was such a singular experience, I feel like everything stood out. So I could reminisce about almost anything, and it was very special. I was fully aware that it was an incredible and extremely special time. There was no question about that.
And Dr. Ann, 2 things when you were on, if I may, you broke your arm, and you were in a cast for a lot of those
my wrist,
episodes.
This is how you do it. Take another piece of paper and glue the 2 ends onto the insides. And it's for a handle. And here you have it.
And also, you got your braces.
I did get my braces. I still have marks on my teeth from that.
Some of you may have noticed that I have braces. Well, the other day, I went into the orthodontist to have the bottom caps put on. Tinsel teeth indeed.
I did get my braces. I still have marks on my teeth from that. Those were definitely 2 of the little things that happened to me. You know what? Actually, Walter, I broke my wrist. And that happened right at the very beginning when it was the beginning of season 2. I can't remember, but we were doing the, you hop out of bed in the middle of the night, that thing.
When you jump out of bed, look around your room, you're going to write it all down and send it to Zoom.
Anyway, how I broke my wrist was jumping off the second bed in that nightgown, and we had socks, which we never wore socks because for some reason they wanted us barefoot. And I slipped and went and smacked my wrist on the cement of the studio floor because it was all made out of cement. And that's how I broke my wrist.
But you were in a cast too. So some of the episodes.
Like this.
But no, but like a sling though.
I did have a sling. That was right after I broke my wrist. Yeah.
The first cast, they were talking, Tracy hurt herself and had to go to the hospital, and that's why they started the Zoom rap. Have you ever been to the
Yes.
hospital? And I think David fell off the M. So
Yeah.
I mean, it was
Timmy fell off the stage. He injured his leg. I don't know what the
A bunch of
insurance
kids running
things were.
around. I know, right? Well, that contract we signed, we didn't have any claims of anything.
That's true. That is true.
but they showed you going to the. Did you get your braces on or off?
I
I can't
got
remember.
them off.
Because you look like you said
And
I look like half a vampire. I remember that.
oh, it was crazy. And I have white marks on my front teeth that are from that because that was actually crazy, Walter. They had a TV crew, so that's at least one camera and somebody holding the camera, and then somebody carrying around the stuff of the camera, and then somebody else telling everybody what to do. So three large adults and a giant camera in a very small little orthodontist office with the orthodontist and me and one of my parents, because a parent had to be there. And so there's way too many people.
About 3 years ago, I had a fang that made me look like half a vampire. The dentist told me that the only way to fix it would be to have some teeth pulled and get braces.
So we're gonna blow some air on the teeth.
It wasn't that bad. This film looks as if braces are really terrible, but the only thing that hurts is having the wire put in when it gets twisted to make it tighter.
Unbelievably hot. And they were trying to get shots of my mouth, which is obviously complicated. So I had to be really still. And they kept saying, oh, that's not good enough. Or the dentist would say, can I do that one more time? I don't think you really saw this. They took on and off my braces probably 6 times. And they put the glue on, and then they had to dissolve the glue and then pull them off. And then they did it over and over again. We were in there for a really long time.
You're a good patient.
I remember when Mike was on. Do you remember, Donna? He had to get his tonsils out. So they followed him to the hospital.
Yes.
And you could tell he was he was scared. God
Yeah.
bless him.
Oh,
And,
yeah.
but you didn't look scared, Anne. You just
I
you were
don't
brave.
think I was.
No.
That was part of where I learned to just kind of like not be in my body for a little while. Just let that happen.
Yeah.
Oh,
I make it
So
sound
you-
like I had to spend a lot of time not I love doing Zoom. It was so fun. The creative energy was outrageous, and being exposed to that level of professionalism literally all around us. I thought it was so cool. It was just amazing professional creative energy that was being focused on us 7 little kids, setting us up correctly and then letting us be. That must have been hard for a lot of people. They really, really believed that given the right place, children could be cooperative and creative and send good vibes out into the world. And you have to set that up for kids to know how to do that. So I think the unseen adults of the group truly were amazing people.
Yeah, they were the backbone of everything. They really did create a safe space while we were there and filming. I think the one thing that hindsight, I don't know if any kind of production with children, I think they're trying to get better, but I had a difficult time after being on Zoom. I'm wondering, maybe you can tell me what that was like for you when you got off Zoom.
Really, really hard, incredibly hard. And again, you have to believe that the people who made it hard had no idea that I was actually a person, because otherwise it wouldn't have been like that. But we happened to move from Boston to Chicago almost immediately after I got off the show. And the timing there was different. So new episodes were still coming out of me when I was there, right after I'd moved there. And the word was out that there was a Zoom kid coming in. And so I was just known as being a Zoomer, nothing else at all. And people just went bananas. Like I was really personally felt very isolated, and like nobody was going to ever want to do anything other than sing the Zoom song at me, not to me or with me, but at me. So I was moving through my school day or whatever. And that was an interesting challenge. And weirdly, it continued for years for me, mostly because the Midwest did reruns of our cast for so long, but I just didn't look that different. And I went all the way through junior high, high school, and college, and people still recognized me in the grocery store. Like it was an absolutely regular part of my life. that wherever I went, somebody would say, "Aren't you in from Zoom?" Or "I know you, weren't you on that show?" Or people would say, I know you from somewhere, but I
Mm.
can't quite place it. I got that. I still get that now as an adult, but I honestly think enough time has passed that's not there.
I'm Maura.
Hi,
There's
Maura.
Maura.
I
Hey,
see
Maura.
Laura.
My apologies for interrupting your little soiree here last minute and being late.
No,
No
But I wouldn't miss
problem.
this for the world because I would love to hear more about your backstory.
Oh my gosh. Oh, Maura, it's so good to see you. How are
Yeah, it's
you?
great.
Likewise, I'm
Great to
good, but
see
this is
you.
about you today.
Oh my God.
Yes.
Well, it's
Yes, it
always about
is.
all of
It
us.
is. And thank you for being a co-host today,
yes, Mara,
Maura.
thank you
Yeah.
so much.
I wouldn't miss it for the world. It's like
Just
my
for-
Zoom big sister.
Oh, I know. That's what I was just saying before you
Yeah.
got on, that like I started thinking about you and I realized you're going to be here and all the things that it was a little bit like parallel play. Like we did all these things together,
Yep.
but both of us are having this very intense experience. And so like
Mhm.
you're probably the only, well, you are literally the only other woman in the entire world who went through what I did at that same age.
Yeah, it's true.
And
That's
that's
true.
just a big deal. I mean, it's kind of remarkable. It really
It
is.
is. It is. It is. It's nice that all these years later, it's as if time just never passed when we all get together, when we talk. It really is like getting together with family.
Yeah.
As we were talking about when Anne moved to Chicago right after the show got over, and she was saying that it was, a difficult transition and just trying to find your way. First of all, there's always the new girl.
No
There
matter what.
tends to be jealousy around that age anyway. And then you have the stigma of being the Zoom kid. What was it like for you?
I think it was more like teasing and like people singing the song or crowding up, asking me for autograph, like that whole thing. Like a lot of people ask me for autograph all the time. I think kids don't know what to do with themselves. Again, I keep saying me versus not me, but like if you meet a star and want to take a picture of them with your phone, you're not doing that because of the star. You're doing it because you want the picture of yourself with the star. So the person is having that experience for themselves. And so again, I felt kind of like a placeholder, like people were having an experience of being able to greet somebody that they knew from TV or whatever, or tease them, or somehow be in that orbit is the wrong word, but be in that space. And that was their choice that they wanted to do it. So I recognized it didn't really actually have to do anything to do with me, but it did make it harder to make real friends. Of course, again, can you make real friends when you move in middle school or the beginning of high school? I don't know. That took a while anyway. But I mean, that time passed. I've got a fantastic family and did actually meet some wonderful people that were really good friends. And by the time I was in college, people recognized me. And at that point, I was like, yeah, you're right. That's me. Bye. I'm going to go get my Cheerios now.
Did you continue performing
Oh my
as a
God,
teenager?
no. My parents were like, she's not going to go to the child star route. According to them, much later, there were opportunities, but they turned every single thing down. They told me, nope, they didn't want me to do any of it. I didn't do any plays, zero. I actually got into a theater school in Chicago that you had to apply to and blah, blah, blah. And we went and looked and they said, we don't want this for you. It's not normal. We want you to go regular high school. So they wanted that phase to be like a one and done.
Did they know you were going to be, that you had applied to be on the show when you did the tracing thing? When they found out, how did they?
I mean, well, not like that. I didn't sneak. My mom did know. She said, okay, sure, go ahead and go. Have fun. Have a good afternoon.
I have a question for you related to this. You got into this school, your parents said no. Is that what you wanted?
Yeah, it really was. I knew that being in Zoom was like really not normal.
True.
And at that point, I just wanted to be normal. I guess I did believe them enough that I was average and nothing special, that I just didn't want to like try to go do something that I wasn't going to get anywhere. Like I didn't want that. And I didn't even know what I did want. Like I had no idea. So I just felt like it would be better to just be normal for a little while and see what was going to happen. I mean, I never wanted to be an actor. That's never been something that I
Yeah.
wanted.
What college did you go to?
I started at Boulder, UC Boulder for 1 year, and I immediately transferred because it was in the late 1970s and there were so many drugs there and it was scary to me. So I changed
Mm.
and went to University of Wisconsin at Madison, I was there for
Okay.
4 years, actually 5. I think by the time I got done with my pre-meds, that's where I stayed. And that was great. I loved it there. It was a great school. Okay, so I started out as a political science major and then decided that wasn't really what I wanted to do. And then I switched to what's now called radio, television, film. And I stayed there not to be on the camera side, but to be on the other side. But then I started thinking, okay, news anchor, that's interesting. You get to interact with a lot of people. But then I realized that nope, you're just talking about what other people are doing. That didn't sit right enough with me somehow. And then I swear to God, this is true. I had an epiphany in an elevator, which is really weird, but it's actually true. And I was going up to my apartment, grappling with what could I possibly become. And somehow the thought came into my head, you could be a doctor. And swear to God, I'm not kidding you. The elevator shook a little bit and then it stopped and the light of the elevator got really bright. And I was like,
oh my goodness.
Wow.
maybe I'm
You had a
supposed to be
paranormal experience.
No.
what? And then everything settled down. The elevator started going. I turned to the woman next to me. I said, did you see that light get brighter? And she's like, no, honey. I'm like, did things slow down for a minute?
Wow.
And she's like,
How old were you when this
No.
happened? I love this story.
isn't
How
that
old?
funny? I was a junior in college. I mean, I did my
Okay.
pre-meds. I should have been
Okay.
graduating. And I went back and did all my pre-meds in I can't remember, a year and a half in a summer school, I think, or something like that. So just piled them all in.
After that experience, you got into your apartment and did you like just sit for a second or did you write it down or
Totally.
what happened
And I
right
went,
after that?
whoa, no, I've never been a journaler. Although I'm a little bit now. I was like, oh my God. And then I'm like, okay, I got to really think about this. I've changed my mind so many times. And please understand that my father's a physician and he's an amazing doctor. And so I have an incredible, like extraordinarily high level image in my mind of what it is to be a doctor and an amazing like role model. He's just an incredible. My family's always been hyper into education. So, but I didn't tell anybody for a little while because that would have been a big boat to rock. And then it didn't go away. And I finally went into my college advisor. This is another true story, a man. And I said, I've decided what I want to do. And he's like, oh, really, honey? What? Because, he didn't say honey, but because I've been in there a few times telling him other things. And
Yeah.
I said, I've decided I want to become a doctor. And he was the first person I told. And I swear to God, reached over and patted me on my knee. And he said, oh, honey, I wanted to be a doctor too. And look where I am now. And I'm like, and guess what? I'm
Patronizing.
never going to sit in your seat ever in my life.
Again.
And I said, all right, what's my first class? And I actually did get a D in physics my first time around. I had to take it twice. So it was not an easy road. But back in those days, I think it was a little easier than it is now.
Who we are, who are we? One good turn, student health, agency resources, education.
I think it's weird that Zoom's called Zoom. I always thought that was
I think it is
How'd
the
that
weirdest thing. A Zoom podcast on the Zoom platform.
Yeah.
Well, and in COVID, when COVID started and they were doing Zoom calls, I think it was the New Yorker, one of those prestigious magazines that did an article on Zoom because
reference Zoom.
Yes.
Yes, I saw that too. I thought it was interesting.
But anyway, Dr. Ann, you went to medical school.
Oh,
then
so I went to medical school. I went to Rush, you're right,
Rush.
which I absolutely loved. And I think my favorite thing, I think that's probably where my global health stuff my interest in that got started because my favorite place to work there was Cook County Hospital, which we got to work there. And it was still such an old hospital with just long rows of hallways and patients on beds with just nothing but curtains in between them and windows open and the admitting ward was just a big room where patients were lined all around the outside, and there's a group of doctors sitting at a table facing each other on the inside. And so there's a really good collaborative environment. I was a medical student, not a doctor, but there was a really good collaborative environment there. And I loved that patient population because everybody's lived experiences were in their bodies. And it was just a really, really profound place to work. I felt very honored to be there.
And then, it's now a high-end hotel.
Yes.
Okay. I just
Yes.
didn't know
It is no longer the Cook County Hospital that it used to be, which is really sad.
Did you have to choose a specific focus of what type of doctor you wanted to be?
You do that at the ends. So when you first start medical school, you go through rotations in every different, first you just learn all the basic science. That's the first couple of years. And that's a lot of studying and very little clinical experience. And then the second couple of years, you do surgery for a little while and family practice and pediatrics and all the things, OB-GYN. And I really, really liked all of them a lot. And so funny because now if I looked back, if I was going to medical school now, I never would have gone into family practice. So I think it's interesting that I chose it. I'm not quite sure why I chose it, except for, again, I think it was because I met such interesting people as patients when I was there. But I was torn between whether or not I wanted to do family practice or psychiatry, interestingly. I've always been fascinated by human motivation and what it is that brings some people to one place and other people to another place, and how much of that has to do with what's inside ourselves versus the experiences that happen to all of us. Always been fascinated by that. So anyway, I picked psychiatry. You guys, I've not talked about myself this much in probably a million years.
Well, please continue because it's really great.
Fascinating. Absolutely.
Thanks for even listening.
We want to listen to you as much as possible.
I picked psychiatry and moved out to Boston and started at the Mass General Hospital, but I had to do a year of internal medicine first, which was you're required to do a year of regular medical internship as a doctor before you start psychiatry, and had a really rough year because it was a gunner hospital that I worked at, and the people were really good, but really competitive, but I learned so much. Then I got to psychiatry and I got to work at the Mass General Hospital in their psych ward. And I tell you what, those people are crazy. And it was so cool. Everybody was like, it was all the acute psychosis and people who had a bipolar break on the airplane. They get brought in by the police and suicide attempts. And everybody needed help right then. It was a like emergency psych. It was so interesting. And I loved it. I loved being able to talk to people in whatever state of mind that they were in. And I loved being able to figure out a medicine that I could give them quickly to give them some relief so that they could start to participate in their care, which is really important. I just loved it. And then I got to the part where I had to do therapy, and I was supposed to be really quiet and the other guy was supposed to talk. And that was really hard for me. I really just like to talk too much. And I'm like, you know what? I don't think I'm going to be able to sit and not talk. I mean, I realize you're supposed to, give some pithy analysis at the end of the 50 minutes or whatever, but I was also really nervous that I was going to say the wrong thing and I'd mess the person up. So I decided, you know what? I don't think this is what I want to do. I think it really was family practice. And so I switched after a full year of psychiatry. So I had 2 years of residency to family practice. And I also got married to my beautiful husband, who's walking around out here someplace. And he's a Texan. So we ended up in Texas. And,
he's a doctor too.
He is a doctor. Yes. He's a kidney specialist. And I finished in family practice at the exact opposite of the incredible academic mecca I had been at for the last few years, instead at a small community hospital right here in Austin. And so it was a much less academic experience, but a much more hands-on experience. I delivered over 100 babies, all the things, like did actual real surgery, like all the things that a family practice doctor in a small town would do. So like appendectomies, like there was a wide range of stuff. And so that turned out to be a great education. And it was a really fun way to learn how to think very academically and scientifically, which I think has been really important to what I'm doing now. And also learn how to provide care to people where they're at, which is also really important to what I do now.
Yeah.
So weird path. Most people don't change their residency. That I don't even know anybody who did that.
Before you started, you were saying if you did it now, you probably wouldn't go into like, what would you do now? if you were just starting
I would
out?
probably do a surgical subspecialty, like obstetrics gynecology. I loved delivering babies, and that's got a really good surgical. It's got a tough lifestyle. There's a lot of call. So, but family practice has become, unless you're really working in a rural place, you're a jack of all trades, a master of few, do not get paid well at all. And it's hard because mid-level providers can fill that space. And I don't want to get into talking too much about medicine in a way that's different from a way a doctor can. And it's changed a lot of medicine. That sounds blamey, and I don't want it to at all. That's not what it is. I mean, medicine is just profoundly changing anyway because of our culture. That's really why.
And
It has nothing to do with the practitioners. I don't know a single person in any kind of medicine, from being a care tech to being, the most high level surgeon, who isn't doing it because they love medicine and want to take care of people. And that is the most important thing.
I suppose the whole insurance thing really put a major wall in the kind of care that you want to give and what you're able to.
Yeah. And it's interesting because it's a resource constraint to physicians being able to do their best work. I now work in a world where there are innumerable resource constraints, insurance not being one of them, but the concept of how do you get around whatever the paywall is also fascinating. And again, I can't use the word paywall because where I work, people don't usually have anything they call pay. But the concept of that there's a divide, there's a gap or a bridge or a wall or whatever between me and you, and can we meet someplace that serves everybody's needs and gets the job done? That's really interesting.
So I'd like to talk about One Good Turn because I'm just fascinated by it, and I just admire you, and I just think it's just a beautiful organization. And for those of us who are just hearing about it for the first time, can you explain what One Good Turn actually does, like on a day-to-day basis, and just help for our audience to become supporters of what you're doing?
I love that. Yes, One Good Turn is the name of our nonprofit organization, and the mission is that we provide practical medical education and culturally relevant clinical care to resource-poor communities all around the world. And I do that with my amazing team, not really by working with doctors or going to academic sessions in other countries, but instead going to places where there are very, very few resources. But the community themselves have identified that there's a problem that they would like to work on solving. And so we only go where we're invited, because you cannot enter into a system as an unwanted participant and have a positive outcome. That just doesn't happen. And so we go to places where people have identified that there's a problem. Maybe they've got a skin infection in the community with little bumps all over the place that didn't get cured with antibiotics because it's scabies and they need a different kind of medicine, but they don't know that yet. Or maybe they have an eye illness, or maybe they have a lot of malnutrition. There's many, many different reasons that we might come in to the community. And then I work with the lowest level caregivers there, because they're the people who see the largest number of patients. And also, in so much of healthcare is siloed and very vertical information. And so people that are sort of at the lower end of the totem pole, as it were, who are also seeing patients, are also much more amenable to being told information, given information and told what to do, and they can talk back because they're used to exchanging information, as opposed to a lot of people up at the top of a totem pole are uncomfortable when they're exchanging information because of losing face or authority levels. There's all sorts of fascinating ethical things about where you can enter into any kind of a system and have impact. And this is one of the reasons that I think global health, really every single part of it has an intersection with pretty much everything that anybody does. Understanding systems theory, you can't do global health unless you really have a good understanding of that. Anyway, we go in to these environments and we find out what do they have to take care of the eye infection or the skin illness. And we create a treatment protocol and like an identification process that uses what's already there. So I don't bring medicine because that's not sustainable, right? If I brought 100 Tylenol someplace, it'd be gone in 2 weeks, and then they can't do what I've asked them to do anymore, or suggested that they might want to do. I don't ever ask anybody to do anything. People have their own power over their lives, for sure. So that's what we've been doing for a really long time. What we're doing right now is particularly exciting to me because one of the schools I work at just outside of Nairobi in Kenya is in a slum, which is more politically correctly called an informal settlement. But those
Okay.
are places where the walls are and the roofs are just corrugated tin and there's mud running down the streets and everything is very informal, including the schools. The school asked me if I could help them start a school health program because they saw that if they could teach kids how to wash their hands and how to recognize what to do with a cough and how to treat a wound, that the children would be healthier. And I said, sure, sure. Let me just go look up a school health curriculum for you, and then I'll tell you what to do. And here I'll hand you this curriculum, and we'll talk about what's most pertinent. And we discovered that even though every major healthcare organization in the world, World Health, UNICEF, all of them, USAID, recommends school health programs, nobody ever wrote one.
Huh.
And I was like, well,
Oh,
really?
that's
Like they
hard to
tell you all
believe.
the outcomes that they're supposed to have. It should reduce attendance. It should
Right.
make kids get better. Like all that is there. And, it should address wound care, blah, blah, blah. As a matter of fact, the World Health Organization has what has become to me a very helpful chart of the top 10 causes of illness and the top 10 causes of death for school children all over the world. And so we wrote our curriculum on those 20 topics. And then also a lot of stuff about diabetes and hypertension and processed foods because of what are called non-communicable illnesses, which are diabetes and hypertension, cancer, things you can't catch from another person, but that you can avoid if you make good lifestyle changes.
Mm-hmm.
Obviously, you can't avoid all cancer with lifestyle changes, but certain ones you can, like lung cancer if you don't smoke, that sort of thing. So we did that, and then we just tried it out in 10 schools. And I got a little grant to try this curriculum out in 10 schools and to do some data. And I'm a scientist, so we had a bunch of data reporting and demographics. Did the kids come to school or not? Lots of endpoints for things. And it was ridiculously successful, like so successful that I was like, can you guys run those numbers again? Because there's no way we just did something that has that much impact. But we did. And not only that, we knew that it was powerful because the schools started telling all their buddy schools. And then suddenly we had 43 schools, and we had 43 schools in the pilot program that we've just finished all the data around. And while we've been running those numbers and we started to run out of money, the program kept going, and it's now in 111 schools. And next week, they're going to start another 20. My amazing staff in Kenya, they're just incredible. And so we've got like, I don't know, 43,000 kids now. And at the first year of being in the program where they have a school health officer, we teach the teachers how to do this. They come and volunteer, and we teach them wound care, and we teach them how to take Advil, which is ibuprofen for menstrual cramps, which I don't know, Walter, you probably have never had menstrual cramps, but it's
A long time.
they are horrible, and it's amazing around the world. People don't know that you can take 3 Advil and they go away like that. So something like that not only keeps the girls in school, but it also keeps the women teachers in school, which is incredibly important. So we've documented like 94% of our students and teachers report that Advil is keeping them in school. So it's simple stuff like that. But
Wow.
the program had to be written by a doctor, but it doesn't have to be taught by a doctor. It doesn't have to be learned by a doctor. It's not. It's focused on schools and kids. We have a health club activity book that the kids actually learn how to clean the wounds themselves instead of the teachers always cleaning their own wounds. And stuff like how do you float? Because drowning, weirdly, is one of the most common causes of death in little kids aged 3 to 5. And maybe it's 3 to 9, I can't remember. And that seems weird, but you know what? Kids fall into water tanks because they want water and they can't get it. And so then they fall in a water tank, and then they're going to drown because nobody knows how to swim or
Yeah.
float, because how could you when there's no water? So we teach them really simple things like that. And road accidents are the most common cause of death of all kids aged 0 to 19 around the whole entire world. So a lot of road safety stuff, pedestrian safety. So anyway, it's been really exciting, and I'm about to embark on a new phase of this because it's amazing. We had in the first year like a 33% reduction in health-related absence, which is so huge because for every year that a kid stays in school, their economic benefit as an adult grows by 10%. I mean, it's just remarkable. And you keep girls in schools, they don't have babies when they're 15, it changes their life forever.
Yes.
So there's so much that, and malnutrition, if you catch moderate malnutrition in an 8-year-old before it becomes severe and get them the right food, which we teach in the program, and people, it's not like they want their kids to have malnutrition. They're just not quite sure, like they don't know what protein is. Nobody told them that there's no protein in rice by itself, but there is protein with rice plus beans. So if we tell them that moms will, let's get our kids protein. Now we'll put beans on their plate. And so anyway, it's amazing. And I'm very excited that it works. And now what we need to do is go tell everybody. So we got to tell everybody so that people can use this program, because since it's based on the top 10 causes of illness and death for students around the world. I'm doing it in Kenya, but it'll work just as well in Central America. And so that's the goal, is to just share the SHARE program with as many people as we possibly can. It stands for Student Health Agency, Resources, and Education.
Okay.
But it's a 1-year program. And what we do is bring teachers, volunteer teachers, from 20 to 50 schools together, like 4 teachers from each of these schools together in a common space. And we provide them over the course of 1 year with 3 training sessions. And they get a lot of practice. Like we teach them how to make oral rehydration solution, which is a very simple solution of sugar and salt, that if people have diarrhea, which is the #1 cause of illness and death for children, the treatment for that isn't antibiotics, it's maintaining your fluid, because dehydration is what kills people from diarrhea. But oral rehydration solution is profoundly underutilized. I just read a study that said in all of Africa, maybe about 36% of the time that a kid needs it, they're going to get oral rehydration solution. So we teach our teachers how to make it. It's really easy. You just do it with sugar and salt, and everybody makes it together, and then everybody drinks it, and they're like, oh, this isn't so bad. And they feel better if they had a headache. And our teachers now give their students oral rehydration at 78%. So more than twice the rate that is normally given. So it's that kind of thing. And I think the fact that we do it in a large group of teachers that can ask questions, you know how it is. If one person has a question, probably everybody has that question. And it gives people a chance to articulate things. And then they all practice together with all sorts of things. We do malnutrition screening. It's a wide range of things. And then our staff, they're called facilitators, after they do this training, goes and visits each of the schools to make sure that they're set up right. We give them a school health kit, including a blood pressure cuff and a scale, and these special tapes called mid-upper arm circumference tapes. Yeah. So that's to look for malnutrition. So right here on your arm, right in between your triceps and your biceps, right there, if you start to become malnourished, that part of your arm reduces at a rate that's been like proven, or the data is there to tell you if this is thin or thick, whether or not you have malnutrition or not. Okay. And it's because there's not a lot of muscle there. There's more fat. There is some muscle, but so that area has been standardized compared to a child's age, what their mid-upper arm circumference can be. So it's this really simple tape. I don't have one with me. I wish I had one right now. You just make a little loop in it and you slide it over the kid's arms, and it's got a color coding on it that says green, the kid's fine. Yellow or orange, they're mildly malnourished. And if you come to the red when you pull the loop, that means they're seriously malnourished. So it's a super easy way for teachers to check to see if the kids are malnourished. And the reason we provided that is that people would come to us and say, we think our kids are malnourished in this school, but we have no way to prove it. And I'm like, well, I can help you do that, because once you prove something, if you have data, you turn observation, you turn that into data, then you have science. And if you have science, if you've got something objective, you can take that result and go to a food program or the government and say, we need more resources here in this environment. And you can also monitor your therapy, which for these kids, we provide them with local food sourced recipes with greater amounts of nutrition in them, which is what the World Health Organization recommends. They say make your protein supplements with local foods. Very easy then for people who live in a place to be able to do that, just as long as we can tell them which foods have the right protein and carbohydrates. And now they can use the same tool that they use to diagnose the malnutrition to see whether or not what they're doing is helping. And so we've turned observers into scientists and also people who can intervene, who can take action. And so we're giving them agency and we're giving them autonomy. And now I'm getting philosophical on you, but health literacy means that you understand that there is such a thing as malnutrition. Health agency is to know that there's malnutrition and to be able to take an action to improve that. And so we're trying to do two things: increase teachers' health literacy so that they can increase their own health agency by giving them understanding of what the problem is and then giving them tools to solve the problem themselves. We don't do it, they do it. And then that's empowering to them. And then they give it to the students and then they tell their families.
That's a great illustration of what empowerment is for almost anything, is to have the literacy of what it is and then the agency to do something about it, put that onto the world and
the entire world.
It's very, very exciting.
Yeah, that's exactly why I love global health, is I do feel like every concept that is well illustrated by a global health dilemma, you can generalize that to anything. Like what I just said is for sure. I mean, when we teach people, it's what is it? Why do I care? And what can I do about it? And if you answer those three questions, then you've given somebody literacy and agency.
Yeah. Yeah, that's amazing. Are you doing any other countries yet?
You would go anywhere. We did the pilot program in Kenya for two reasons. First of all, we were asked to do it there, which is the most important thing.
Yes.
Also, English is the national language of Kenya. Everybody speaks Swahili also, but the textbooks and everything are written in English. And so I can talk to pretty much anybody there. I worked in Cambodia a lot several years ago, and I absolutely loved it. But people there do not speak English. And Khmer, the language there, has almost no similarities to English. So I couldn't really learn to speak Khmer. I was very dependent on interpreters, which is fine, but it would have made it very difficult to test this product, if you want to call it that, this curriculum, because I wouldn't have known if we were having translation issues or if we were having outcome issues. So that's why we tested it here in Kenya. Right. But I would love to go anywhere, really.
I feel like we could use you in the United States as well.
Oh my gosh,
there's
absolutely.
A lot of underserved communities around here too.
Definitely.
The idea of giving students and teachers literacy and agency, it's a global necessity.
Yeah,
totally agree. Very, very true.
Dr. Ann, I was going to ask you, when you go into these different countries and cultures, do you ever find any resistance? Like that here's a bunch of rich white people coming in and telling us what to do? Does it go a lot against some of their local culture or practices?
Always.
Oh, does it?
Oh, yeah, absolutely. I mean, wouldn't you? Like, who's this person? Like, what? My clinic runs just fine. Why is this lady coming here? I mean, I totally vibe to that. And that's also another thing that's fascinating. I mean, that's true clinically, like in terms of who comes to see me as a physician when I'm running a clinic. It's interesting. It's usually the moms with the really sick babies. And then once they see that everything's okay, then all the older men and women will come. And then the last people to come are the guys, the young adult, which is fascinating. Yes, of course there's resistance, but since I totally expect that and would almost think it was weird if there wasn't. I mean, usually the people who've invited us are glad that I'm there, but the people who knew it was happening, but maybe didn't have a say about it, but they were still going to be involved, they might not like it. So then the trick is to find out what they care about. Is there anything that I can help a person who's not interested in my being there? Do they have anything that they want to talk about? Maybe they want to talk about antibiotics. Maybe I had a group of nurses who I talked to them a bunch about hypertension and said, you can ask me anything you want. And they said, how many goats did your husband pay for you? So we talked about that.
Yeah.
They thought the concept of a tiny little sparkly white diamond was utterly ridiculous. And I'm like, you know what? You're right. It actually truly is ridiculous. Better. I don't know why we do it that way. So you find that common ground, and there is so much common ground. And I think that is the whole, like the concept of being able to build a relationship with people across a barrier, that goes right back to Zoom. Like knowing that you have to build a relationship with somebody across a barrier makes it an interesting challenge. And it's not about me being right and them being wrong. That is not it at all. It's just that I have a subscription to the New England Journal of Medicine and they don't. And so is there any article that I can tell you about? Because I'm standing here with this information if you like it. And I mean, the New England Journal of Medicine doesn't necessarily apply to a lot of the places that I go, but I'm giving you a metaphor, I guess. And I learned just as much. The flip side is also true. I cannot read about what I see because I see stuff that nobody else sees and people don't write about it. So I'm also learning so much about humanity and how people do their best to solve the problems that they have based on what they understand as being the problem and solution. It's all of us are that way. And so it just happens that in medicine, we have a little bit more science to prove. It's like not like philosophy or religion where you have to go on a certain amount of faith. We have a little bit of science to prove it. And the other thing that always works really well is that if I can do something that's going to make somebody feel better really fast, then it gains people's trust if they see that the doctor actually made a kid's eyes less red or something. So I work on that.
For anyone watching this who wants to volunteer or help and support, how do people participate in funding?
Oh, that'd be so great. So the name of our organization is One Good Turn, and the website is onegoodturn.org. There's a bunch of tabs on the website. You can click if you want more information or if you want to volunteer or get involved, get the newsletter, which that would be great because that's a little bit more in depth. So would love funding. Funding is the world of medical funding in global health has profoundly changed since USAID was dismantled. So that's its own 2-hour conversation. So yeah, we're just a teeny little organization, but it turned out that the thing that we experimented with works really, really well. So we just want to share it with as many people as we possibly can. We want people to take the program and do it someplace else. I would be so happy if some big organization came and said, hey, we want to run your program. I'd be like, have at it. Here it is. You can have the whole thing.
Just so proud of you. And you're just doing so much to help others. Giving people literacy and agency is very, very empowering. And you've gone from being one of the, the sweetest, most lovely, well, all the Zoomers were lovely, but
yes,
a lovely young person to an incredible adult who I admire so much.
My name's Anne.
And I find extremely inspiring. I have a question, like, how do you feed your tank?
Oh, that's a good question.
Wow, thank you for asking that. These days I'm not filling it enough. I'm very aware of that right now. Because I work too much. But my family, my husband and my grandchildren and my kids, they're all grown up. My oldest son just got engaged.
Congratulations.
Get such joy from all of them. They're amazing. I love being outside. We live in a comfortable place where I can run around outside a lot. So I love being able to take walks and travel and be outside, that sort of thing. I do some, spiritual reading every day. That's incredibly important to me. My church is really important to me. My dear friends are incredibly important to me. So I think all of those things. I think that the things that rejuvenate me now, I'm drawing parallels, but I will keep doing that, are pretty much the same things that brought me back to myself with Zoom, which is to remember, go outside. It's green and beautiful out there and it smells good, and be with your family because they knew you when you were 6 and there was no such thing as Zoom, and connect with your friends in sort of at a level that we've been talking today, which tells me that I feel comfortable connecting with you and we can be in this space together because the ways that we were just talking are the things that I really care about. So I would be just as much wanting to listen to you all talk to me about that. And those things I think are just deeply rejuvenating.
You got a Zoom talk.
tell us something nobody knows about, that happened on Zoom.
I don't know. A lot of the things that nobody should know about Zoom happened in the green room, and they will stay in the green room.
They're going to stay in the green room. Definitely.
You know, we were just silly kids, and that's enough.
Yes, that's exactly right.
All we need the world to know.
What happens in the green room stays in the green room. Zoom, 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 zoom. What happens in the green room stays in the green room. Zoom, 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 zoom.
I'm Maura. My name's Anne. I wanna zoom, I wanna zoom, I wanna zoom. We are the witches of Halloween, the queerest witches you've ever seen. We have stirred our witches' brew, and soon you'll see what comes out of us. Witches brew, the little hobgoblins come out of our stew.
So who touched the dry ice?
All right. I don't know that anybody actually touched the dry ice, but they were very, very adamant. Do not touch the dry ice because it could burn you. But you know, when you tell a 10-year-old don't touch the dry ice, the first thing they want to do is go,
What's in there? Looks kind of good.
Hobgoblins come out of our stew.
Was there a production number? Walter, do you remember? Because he's got the Zoom mind of steel.
yeah.
Well, there was Cookie Tree. What was the I played a little joke. I can't sing it. God no. A tree, Cookie Tree, or
That wasn't us.
that wasn't. But oh God, Doc. I wish I'd written this down. Flatfoot Floogie with the Voy Floyd.
Oh, I
yeah.
actually really like that one. That was good.
Did
That was
you?
fun.
It was all 40s songs. And it was
Yeah.
a lunch counter, and Maura, you got
Oh,
on
that
top
was-
of the
I did. I got up on
Yes.
the lunch counter.
That was a really good, yes, I really like that one.
Slide eye, slide eye, slide eye, slide eye. Flatfoot Floogie with the flow, flow. Flatfoot Floogie with the flow, flow. Flatfoot Floogie with the flow, flow. Slide out, slide out, slide out, slide out. 6, 6, 6, 5, 6, 5, 6, 5, 0, 6, 5, 0, 6, 5, 0, 6, 5, 0, 6, 5, 0, 6, 5, 0. Pennsylvania 6, 5,000.
Did you know, Walter, that we recorded the songs the week before in a studio, and then we were lip syncing when we did them on stage?
No, I didn't know that.
Yeah,
I
we
did
had a
not-
You didn't
very
know that?
professional, the coach, we had like a singing, like we had to go, "Ooh," like all that stuff. She used to yell at me that I should be able to sing higher, and I just
You had a
kept
singing
relaxed.
coach? We didn't have a singing
Oh,
coach.
yeah. I
Cheryl
remember.
Bibbs.
Yes, yes,
Cheryl.
yes.
You
And Newton
produced the
Whalen. So it was,
Great
that was
guy.
cool because it was very professional. And again, I was appreciative of that.
What was your entrance, your Zoom entrance?
Me, ballet. I think I did a twirl
The
or
dancer. Yeah.
My name's Anne.
In
Yes.
slow motion, yes.
Yes.
Wasn't it?
yes. Yeah. I have, should I show
Now-
you I have my picture. I took it off my
Oh,
shelf.
Oh,
You
did
kept
you look at
it.
the cutie pie?
Isn't that funny? Oh, it's all
He's
blurred.
Adorable.
I had to unblur my, yeah, there I am.
Oh,
That's so funny. That's a
When
good
you would walk into GBH, you enter the lobby, and then there was a doorway that they would buzz you in. And as you came down that hallway, there were pictures of us
Yeah.
during the season that we were doing the show.
Yeah, that's the original picture.
Yeah.
Nobody ever had it framed. I don't know. It's the only thing I have. I have a couple Zoom cards someplace, and I have that Zoom catalog.
Mm.
Yeah, that's so interesting. Did you guys know? I was going to say just weirdly in One Good Turn, it's info@onegoodturn.org is how to just reach into our organization. got an email from somebody. It was about Zoom saying that they were happy to have found me. And yeah, it was really nice.
Can you still speak Ubby Dubby?
Kapamaban yabukaban.
Sure.
Bust.
It's kaban dubba flavik rabadaming abba babay sabo kobble.
Yabasabadabas.
You're better than me. I'll need to teach my grandchildren.
Absolutely.
Totally.
What'd you just say? It's coming. It's like riding a bicycle. Did you just say?
Yes. You can still hear it.
What was it like for your children or your grandchildren to see you on Zoom?
That's
I'm assuming
funny.
you've shared that with them.
Yes. My grandkids are too little yet. I have the 5-month-old and a 2-year-old. So they're
Oh,
little.
yes.
Congratulations.
Thank you. They're so
Yes,
wonderful and
yes.
fun. My kids think it's hilarious and now don't think about it very much. But at the time, they thought it was hilarious. I don't know. It's weird. It didn't enter our family conversation very much. I don't know. It's not, but because it was so long ago. I mean, they can't even imagine. They all know, and they all think it's cute and funny. And it comes up every now and then. They came with me to reunions that we had. And somebody recognized me at the airport. Like before we even got there, somebody literally recognized me at the airport and they're like, what? And then we were going through some screening thing and a screening person recognized. So I got recognized twice.
Wow.
And they're like, Mom, you didn't tell us it was like this.
Yeah.
You guys were together the whole time. And who were you on with?
Jay and David.
And who else?
And
Kenny, Tracy, and Nancy were held over from the original cast, and then the 4 of us. And when they left, we got Bernadette, Leon, and Luis.
Yes.
Oh, wow. That must have been a great cast, huh?
It's awesome.
Both of them were great casts. And it's actually amazing. I mean, we've stayed in touch over the years. It's kind of interesting. Tracy moved to Texas, actually before me. And I've seen her a couple of times.
She's in your town.
She is actually. Yes. We're probably 45 minutes away. Yeah. And Leon actually knows my kids really well. When he was touring with Ben Harper, there's a big festival here, Austin City Limits, and they played here regularly, and he would always invite us to come. He was so nice to my kids, and they would have so much fun. He got my oldest son, Reed, plays the drums, and he got him a djembe, and goofed around with him all the time. So that was really fun. We've been able to kind of keep up with him through that. He is such a nice guy. Everybody's so, like, every single person in Zoom is just so nice. It's really cool.
So one of your sons is a drummer.
Yep. I mean, he probably wouldn't say that now. But he was when he was a kid. And he does like to drum. Yep. A little bit of music in the family. No TV stars though.
But can I just say, I just thought of the song I was thinking of. It wasn't Cookie Tree, it was Lollipop Tree.
That wasn't us.
That wasn't you. That must have been the next one. But I know it was on the album that you're.
It was on the Zoom album.
Album. When they revealed Fannie Dooley, wasn't that song?
A double and double.
We did, yeah. Yeah.
F-A double N double E D double O L double E. F-A double N double E D double O L double E.
Yeah.
That's cool.
I was gonna say, was it hard for you when your time was off Zoom? Was it hard to go, or did you say, this was
yes.
Good? Was it?
Absolutely. It was like leaving a fantasy land. Absolutely. It was really hard. I loved all those people so much. And also we spent so much time there. So it was very abrupt. It would have been nice if they'd had a child psychologist or somebody to warn us that it was, you're like, it's like, in the movies where you're in a completely different world than you used to be in. So it was very difficult.
Yeah. I don't think they had any idea.
Yeah.
There are times I think they still don't understand. What we have all learned, I think, over the years is this wasn't a small thing. This was a huge thing. And the impact that it had was, I don't think, ever anticipated. And therefore, I don't think they thought through anything like what would the impact be on those of us who had that experience and then left. I don't think that ever really entered into their thought process.
Yeah, I agree.
But I mean, the whole idea, I've said this before, they continually kind of hammered home to us, you're not celebrities in the traditional sense. And so okay, sure, yeah, we're just doing a show and then we'll go back to our real lives. But it's like the world changes because now, yes, you do get recognized places and you do find out 30 and 40 and 50 years later that the memories that people have are still so vivid in considering the show has not been on in reruns all these years. But I don't know that anybody could have anticipated that type of an impact.
Yeah, I agree.
Yeah, I used to say in stand up when I would talk about Zoom, I'd say, I haven't robbed a video store, nor did I cut my hair totally off. And even then, I thought, oh, maybe I'm just getting experimental.
That's a true thing, though, that the 21 of us that worked with Christopher, who've kept in touch, they didn't end up with those kind of, child star drama stories. And the normal things anybody would go through, but there are no real horror stories to speak of. And that's something I think the people that did the casting should be very proud.
So Donna, when you say you never robbed a video store, that's a
We're
good
glad
thing.
for that, Don.
And
We're
then
very
that's the important thing to keep in mind that
No doubt.
I was also starring in a children's television show called Zoom. I don't know if anyone ever heard of it. Really?
like you were talking about that I think they just thought because you were normal kids and you weren't the Brady Bunch, that everything would just be fine. But I just wonder if they were a little naive because it was a national show. Do you know what I mean?
Yeah, we were on TV just as much as the Brady Bunch.
That's what I'm saying.
That's true.
So I just wonder if, like you said, Anne, about maybe just have like a debriefing after, and say, well, kids, here's here's a little the words of wisdom for you,
Something, right? For the parents.
I think that when I can speak for me, but I think this is probably to some degree true. In the immediate aftermath, you're done with Zoom and you're just back to your normal neighborhood stuff and your school and all that. As you get older, if you move like Ann did, we moved from Boston to a suburb when I was 13. So when you're then now in new environments, or maybe you go off to high school or college or something different, that's, I think, when it kind of the scope of it begins to kind of you become more aware of.
Yeah.
But I think, for the kids in my neighborhood, it was not a big deal. So Maura can't play street hockey today because she has to do Zoom or, whatever. But it was the same group, the same people, your same friends before as it was after. But later in life, as you get out in the world, you learn.
Yeah, that was not my experience at all. Because I was on in 6th grade and then went to 7th grade to a new school. And yeah, I still think I sometimes have PTSD. Sometimes it hits me because I was pretty much threatened to be beaten up on a daily basis. And and this was also again in the 70s when in the 7th grade, kids were really tormenting teachers, etc. So of course they'd be tormenting, if you were jealous or threatened by anyone. So that was in 7th grade, and I ended up having to change schools because I got attacked in my homeroom by 13 girls with shaving cream. And but I went to a high school where those same girls went to that high school. And I remember the first day I got to high school, the one girl, and I won't mention her name, but she was like the big leader of the pack who did not like me. She came up to me and she apologized the first day. And she said, Donna, I am so sorry. And she said, my parents were getting divorced at the time, and I was so unhappy, and I took it out on you. And but just by her apologizing, like we became very good friends. Just being able, like a sincere apology can really allow for forgiveness.
Mhm.
I feel like really the reason I came on this earth is to learn how to love and forgive and have agency and literacy, of course. How I handled it was because I was always being attacked or threatened. I started giving my power away. Like I would be like, "Oh, I'm nothing special," or "You don't need to," like, And I think I kind of became a people pleaser, and but it, and it was because I wanted people to like me, but not just to like me. I wanted them to like me so I wouldn't be beaten up.
So you're safe. Absolutely. It was a safety or
Yeah.
staying safe. Yeah.
So
And
so
people have to give away their power to stay safe. That's another truism all over the world,
yes, absolutely.
which is
Yeah,
terrible. And I think women have to do that more than men,
I agree.
Yes, absolutely.
that is how a lot of people stay safe, is by giving away their power.
Survival skill.
Really weird.
Yeah.
You'd think it would be the other way around, but it's not in practice.
I think it really taught me about self-care too. Like for some reason, if people weren't nice, even if they weren't beating me up for a while, I would get so anxious and think, like if a person just didn't even smile for a little while, I would think they're gonna attack me. It
Yeah,
was
are they
just
getting ready to do something terrible? Donna,
well,
that sounds horrific to me. That's an awful state of being, not even just of mind, but of being for any length of time. Wow. Yeah.
It's a lot of trauma to carry, for sure.
it was a lot of trauma, and that was my life experience. For me, what's helped a lot, and I think it's for anyone, whatever you go through, is I find by taking 100% responsibility for my experience, somehow that gives me agency, and it allows for compassion, because sometimes you don't know, like the same people that you hate or because you're jealous of them, like you really don't know what's going on in their lives.
We interrupt this episode to announce that during the editing, Donna became a grandma to Blossom, and now her world is blossoming all over.
With one good turn, we're talking about humans who are underserved, they need support. So by giving them education and giving them agency, it's like a way of really making the world a better place. Because when you're a happy person, you don't want to, all you want to do, at least I think, is help other people or serve. It's just when you're in pain, it's very hard to help other people live a very high functioning existence. So
Yeah. And it gets back also to the compassion part, because it's so important to not be judgmental, like bring people any service, the way that the service is like, never lend anything, I'll just only give it away, right? The service, you have to do the service without any judgment, like that, oh, poor you. Well, I've got money, so I'm going to give you whatever. Like, no, that's not it at all. Because you're right, Donna, what is going on in somebody else's life is profound to them. And I should never come at it with any kind of judgmentalism, because I can't possibly know what that person's life is like. And on top of that, most people's lives are infinitely harder than mine. And so
I think it's inherent almost that we do judge. We judge not to put our hand on the hot stove, or once we do, we're like, oh, this is probably for a much longer discussion, but we do have judgment. But then it's also about perhaps being self-aware that we're judging and not to act on that.
yeah,
Is that where you got that?
Came from that, absolutely. Yep.
One good turn, student health, agency resources, education.
Learned behavior or a choice?
I think it's both learned and a choice. And I think people can be kind for a lot of different reasons, because what you just said about staying safe, giving away your power, kindness can be that. It can be something where you're staying safe. But I absolutely think it's a choice, because a lot of times when you're being kind to another person, you are also not following it through on what your own impulse would be. And maybe that gets back to your judgment thing. And so you have to choose that path. like letting somebody talk longer than you have time for example, because they really need to talk. So you're going to be lit 5 minutes late to your next appointment, whatever. That's a doctor kindness. That's the kind of thing that but then you have to learn that when you open the door to being kind, there are tremendous benefits to everybody, including me. Like if I'm a kind person, I feel much better about myself too. I can let the little old lady at the checkout stand take a really long time because it's fine. It's okay. Let's say something nice too. Like but then I feel better. So, but I do think people have to learn how to do that, but it's definitely a choice. I guess that's how I feel. Maura, how do you feel about that?
Yes.
I think that in some people, the whole empathy thing is more prevalent than in others. And I think that the more empathetic one is, the easier kindness comes to them. But I also think life experience has a lot to do with it. I think one thing I have observed is that the more difficulties that one has to deal with, the more they're able to see that and respond in kind to others. It's not in all cases, but I think that some people just find it easier to be that way and to exhibit that type of kindness because they pick up on something in others.
Totally. I was reading an interesting book on etymology, which means the meaning of words, the meaning of the words of the words. And when you said that thing about responding in kind, and then kindness, and then it made me think of kindred. And I feel like maybe
kindred,
empathy and kindness and kindred, it's the idea that we are all together in this. So that's all. I just liked I really liked your description of kindness. And I think it brings a more of a depth to what that word really means.
Yeah. For a while, I was trying to develop something called the empathy meter. And I had interviewed Christopher Sarson because he was a mediator and was using empathy. And Christopher Sarson said, empathy cannot be taught, but it can be caught, which means when someone would show empathy, you'd be like, oh, nice job. I love how you're kind just there. So catching someone and represencing their actions would be the way to create the literacy for the empathy.
Fascinating. I love that.
But yeah, Christopher Sarson,
who's 91.
Wow.
He's turned 91 in January.
Fascinating person.
Before we go, what's one good turn anybody can do?
Trash close to your house. Give a kid a book.
Smile at somebody. Just smile at somebody.
Yes, smile at somebody.
Because you don't know, that one smile can make all the difference in their day.
Be patient if someone's moving slowly. Don't increase their stress.
Try this. Try hugging yourself. Because, we can be very kind to others, but sometimes we're not as kind to ourselves. That's one good turn.
That's right.
Tell them that you appreciate them. I mean, that's huge.
That's a big one. People want to be validated. It doesn't take much to do that.
And on that note, may I just say how grateful I am to the three of you. If this was me in the 70s, I'd sedated the idea that I'm talking to the three of you. And I think Donna and Maura, how
we know. Yes, we do.
You've been very special. So, but that's also a good way to really tell you, Anne, I've wanted to interview you for the longest time and truly appreciate you and what you're doing in the world and just who you're being. Maybe we can get you back on here. And I love this Zoom talk we just had.
Maura, thank you for coming on too.
My pleasure. So proud of everything that Anne's done with this organization. She's as genuine as she appears. She has always been that way. And very, very lucky to have been able to do something like Zoom with her, and grateful for that.
Well, you guys, thank you for encouraging me to do this and being patient with me because it took too long, and asking such good questions, having such deep conversation. I mean, it's just really cool to be able to do that.
Absolutely.
I'm so grateful to all of you guys. Absolutely.
Thank you.
This is cool. I hope the Zoom talk just keeps going and going and going.
You got a Zoom talk, come on and Zoom talk.
For information, volunteering, or donating funds, you can go to
Student health, agency resources, education. We are one good turn. Global health to help you learn.
You got a Zoom talk, come on and Zoom talk.
What happens in the green room stays in the green room. What happens in the green room stays in the green room.